This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everybody. Good to have you back here. You found us for a reason. Maybe you're searching for chiropractic services, maybe massage, maybe in the Texas area. North Richmond Hills, Texas is where this wonderful center is located. It's called Spine Spot, and they have all different services from chiropractic to massage and more. And we're going to talk with the man behind it all. He's the owner, Dr. David Kinnison, joins us here today on the program. David, welcome. How are you?
Good. How are you doing today, Steve?
I am doing fantastic. And do you know why that is?
It's Friday, and then you're talking to me.
All right, there's two things, but there's a third thing connected with that. An hour and a half ago, I was at the chiropractor.
Oh, nice.
Yep, no issues. Just going there, getting an adjustment, feels great. Every once in a while you get a little tension up there and all. I wish I was, located where you are, in North Richmond Hills.
Well, keeping that maintenance is going. That's what it's all about.
So I want to get to your membership model for that. But even before we go there, I want to ask the question that most people usually ask when it comes to chiropractic services. And I'm sure you've heard this question or this concern many times. You often hear, well, if I go once to a chiropractor, I'm going to have to keep going. Myth, or is that true?
Yeah, I'll leave it at that. No. But I've been getting adjusted for about 56 and a half years myself. I started at a year old. My dad's a retired chiropractor.
Oh, wow. Okay.
My brother's actually a chiropractor in Barcelona, Spain, and he will be landing here in about 2 hours and 20 minutes. Actually, about 2 hours and 10 minutes for a few weeks visiting.
Look, people travel from all over the world to go to your center to get service.
Yes. But going back to the question, once you get adjusted, you start feeling better. You're like, okay, I feel good. I can stop. Well, there's going to be a period of time that I'm not going to feel so great again. Whether it's just you wake up and you're like, oh, my neck is kinked up, or I call it the weekend warrior stuff. Things creep up. We work, we have kids, we have grandkids, we play sports, whatever the case may be. You change the oil in your car, right? Brush your teeth. How many teeth do you want to keep? Ones you brush.
Yeah, right.
So, the maintenance aspect of chiropractic care, it's not that you have to go. It's that you feel better when you do go. Let's keep that going. Do we need to see you 3 or 4 times a week for the next 10 years? No. Some people, they like that weekly adjustment. Some people like that bi-monthly adjustment, or that once a month. Whatever that maintenance is, that is your maintenance. Just make sure it is a true maintenance. Not, I go to the chiropractor all the time. Well, when's the last time you went? I was like, well, I go about every 6-9 months. Oh, well, that's, you're taking that maintenance out a little bit further than it needs to go. But
do you think the mentality for some is that they look at it as one level up from massage? You're a doctor. I think people forget that, and they think that, well, massage is going to make me feel better. So going to the chiropractor is kind of like that, where it's kind of a hands-on thing. They're not realizing that it is essential. Your spine is everything. Your core is everything. I don't think a lot of people look at it that way, right?
A lot of people don't. It's almost, we're a novelty item.
That's what I'm saying.
Where I've worked in the past, we're a maintenance wellness clinic. Walk in, we didn't schedule appointments, which was awesome. People would walk in and say, hey, man, I got my cousin coming in this weekend. I want to bring him in and have you, give him adjustment. Good, man, you're so good. And I'm like, okay, where's he from? Oh, he's from New York. He comes in about once a year, once every 2 years, whatever. I just want him to see, because you're so cool and so good, and it's kind of like that. But then there's the others like, oh yeah, this is there's a reason why I came, and this was the reason why I keep going in. But we do have that, oh, you're just a glorified massage therapist or something.
Yeah.
Don't get it necessarily in that verbiage, but sometimes that's what we get. And
Yeah.
you just kind of say, okay, and this is exactly what we do.
Totally get it. And that's why I wanted to bring that up. I think that some people don't view how important or essential it is. And, that question I asked you initially about having to keep going, because it's fresh in my mind, can I share my journey? Just because I think it's a typical journey for a lot of people.
Oh, absolutely. I like journeys.
Everybody's different. Everybody's got, different situations when it comes to their spine and, challenges here and there. I haven't been to a chiropractor in probably a year. And I just realized there's one down the street from the studio here. Somebody recommended them. So I was like, all right, let me check it out. So I went and asked the same question I asked you and wondered, am I going to have to keep going? Initially, I went twice a week and, felt relief. And then I started noticing, went a couple of weeks, twice a week, that, all of a sudden, I got pain again. I got pain. I really believe, and your thoughts on this, and you haven't looked at, my situation, but I really believe that in the adjustment where I was adjusted the way it should be, that my body had to catch up to it. They were, know what I'm saying? Right? And because after that, I was fine. I went today for the first time in probably a month, and I was just thinking, it's a little tight. And I actually had a little extra time. I'm like, all right, let me go back again, start it up again. Is that possible that, you could be aligned by going for a session with a chiropractor, but your body has to really kind of adjust to catch up with it?
Yeah, a lot of people say, hey, can you pop this back into place? My neck needs to be popped back into place. And I'm like, well, we don't pop things back into place.
Mm-hmm.
We mobilize those joints. We get the pressure off the nerve, off the joints, and get everything functioning better so the muscles relax, so your body is able to fix and align itself better to a point.
Mm-hmm.
There's some cases where, you're not going to be aligned. You've got too much scoliosis going on, or you've got too much degenerative changes going on, but the body will adapt and normalize itself. And like I said, we got weekend warrior stuff. It's been a month. What else have you done in that month? Well, I mowed the grass, I weed eated. So all these little things, add up. We call them micro traumas. They're not really an injury, but sitting at a desk for 8 hours a day, that's a micro trauma.
Yeah. Sleeping.
Well, some people it's trauma, but
yes, well, depending on the situation, or who you're sleeping next to. But it's like, certainly if your head's not on the pillow right, that can be creating a trauma and you don't even realize it. I would imagine.
Exactly. Yeah, big fluffy pillows are not your friend. They're comfy, but not your friend. Your neck's not going to like it. Eventually it's going to catch up to you, and you're going to be coming in and say, I can't move my head. I can't turn to the left. I can't turn to the right. Well, okay, we'll check it out. Well, what do you do for a living? What are you activity levels? You sleep on, especially for women, they like their 2 or 3 pillows or fluffy and all that. And I was like, well, we need to go down to 1 pillow. That's why your neck probably is feeling the way it is, because you got 2 pillows and your neck is all cranked all night long. And now you wake up and can't turn.
To your point, after I started going to the chiropractor regularly, I noticed after I was adjusted, so I'm going to assume I'm in a good spot, spine's in a good spot, neck's in a good spot. I realized that I had 2 pillows, and shortly thereafter, for the first time, I was like, I'm uncomfortable. Something's not right. I need to go back to the chiropractor. And then I switched back to 1 pillow that is, I'm going to say it's kind of squishy, but you can put your head in the middle and it, the squishiness goes to the side. So I kind of like that. It's almost like holding my head, but basically very thin pillow, essentially. I feel much better. Should you be on a very thin pillow? Just 1?
I'd rather a thinner pillow than a thicker pillow, personally.
Okay.
Also, what is your size? Looking at you, about like me, you're not a super big guy. If you were a big guy with big, broad shoulders, small pillow might not be the best for you. But you want to get a pillow that fits your body style, your body type. You know, if you're a big person with real broad shoulders, you might need a little bit bigger pillow because, you know, if you lay on your side, your head's going to be cranked all the way over to one side or the other.
Sure.
So, you know,
More
finding
to
a pillow is
yeah,
thing.
more to support. I want to go back to your childhood and the beginnings. So your dad was a chiropractor. You were exposed to that, right?
Yes.
Did you know from an early age that this is what I'm going to be doing?
Yes and no. You know, when you're young, you know, oh, I want to be like dad. I want to be like mom. That's, I think, what every kid, or I want to be a fireman or whatever. But, you know, it wasn't until I got older, you know, high school that, you know, I don't miss a lot of school. I'm never sick,
Hmm.
you know, and, you know, my friends, they miss school all the time. And I missed the first 2 days of fifth grade or sixth grade and the first 2 days of seventh grade. Had strep throat, 105, 106 fever, both times. Sick
Huh.
as a dog. Um, Dad would adjust me in the morning before he go to work, come home at lunch and adjust me. He would adjust me in the evening. And I was high dosing vitamin C, and they would wrap me in damp sheets out of the washer to bring my fever down. No medications, um, maybe a Tylenol if we did that. But I was sick for, I think, 3 days, 4 days, you know, went back to school and no problems. Um, so, you know, that's like, well, that's kind of cool. Now you know, get in high school, going to go to chiropractic college and have kind of a vision. I've always wanted to help people. Um, you know, if I can give you a shirt off my back, you're gonna get the shirt off my back. If I can help you with question, oh, what about this? What about that? Well, I'll give you my 2 cents. If it helps you, awesome. If it doesn't, well, at least it gives you something to think about, maybe some other questions to ask somebody else or whatever. But, you know, what you put out, you know, in the little questionnaire, you know, your phrase, your mantra says, you know, what you see in the universe sees you. What you put out is what you get back. And you know, oh, I can never get ahead. Oh, I hit every red light. Oh, I always hit, always. Well, guess what? You're going to hit every red light.
Yep.
You know, I made it to work today. I didn't hit any red lights, and it's 6.4 miles, and it was awesome.
Yep.
But I don't think about hitting red lights because they're there. You're going to hit them.
I completely agree with you. I know we're in a different direction, but also this is all energy, holistic. But yes, it's like what your parents used to say: be careful what you ask for. You're going to get it. Well, yes. And if you wake up first thing in the morning, you spill coffee, yeah, it's going to happen, whatever. And if you're saying, oh, crap, look at the way this day's beginning. What else is going to happen today? This is going to be one of those days. Yeah, you just asked for it. You put it out there.
Absolutely. It's going to come and grab you.
Exactly. The universe is going to say, oh, or your subconscious is listening and it's saying, oh, you want more of that? It doesn't know it's good or bad. Oh, let me give you more of that. No problem. Let's say you have a job interview coming up and you self-sabotage yourself through your subconscious in the interview because you thought you were going to have one of those days. You did.
Wow. You know, I've been, you know, I wouldn't say nervous, but nervous about, you know, a little interview here. But it's fun. You know, I enjoy talking. And if I can share something that helps somebody, you know, whether it's here or another chiropractic office, or it doesn't matter where it is, if somebody gets benefit from what they heard today, you know, it's a win for them. It's a win for me. And that's kind of, you know, way things need to go. And that's what I try to talk to my patients about here in the office.
Sure. It's as if you're wired to help people in any aspect. Doesn't matter what it is.
Right.
Just getting it done that way. Yeah, that's wonderful. I mean, you're an empath, I would imagine. You feel what people are feeling.
Sometimes, yeah. You know, I can tell, you know, sometimes people walk in and I'll look at them, I go, come back here, what's up? I'm nothing. I was like, no. What you got? Talk to me, you know?
Yep.
Let's put the doctor aside. Let's me and you chat this for a second. And they'll say, it's all right, great. We'll talk about it a little bit. And all right, let's get down, let's get you adjusted. And you have a better day. And sometimes you've got to take that doctor hat off and get in and just talk to your patients like a person.
Yeah.
And sometimes that's what they need, because, the person they wanted to talk to either was not available or is unavailable, so doctor hat is on, but the doctor hat also comes off, and you got to be a human being and treat somebody like you want to be treated. So,
Sure. And ultimately, I would imagine it comes back to the way they're physically feeling at that time. That situation that somebody walked in with, where something's weighing heavy on them, well, it's also weighing heavy on, I'm sure, their shoulders, their spine, their neck. Let's look at the other part of the spine spot and services that you offer. Massage, all different types of massage therapy. How do we know what's best for us when we go? I mean, there's so many different types of massage, from deep tissue, Swedish, sports. Is it really you as a practitioner asking those questions, or your team asking those questions, so that we can determine what somebody needs, aside, factoring out, injuries and things like that?
right. Yeah. If you got somebody coming in and they're an athlete, obviously they're going to need to be addressed a little bit differently. They're going to understand their bodies a little bit differently. They'll say, I'm feeling this, I'm feeling that. I can't cut like I wanted to, or it hurts to do the bench press. So what is going on? So that's when you explain or talk to the therapist. Okay, this is what's going on. Let's, check them out, evaluate, and then proceed on with whatever angle they need to go at. Most of what we do here is going to be therapeutic and deep tissue. We can incorporate a little more stretching if we needed to with the massage. Sometimes you've got to, do a little tissue work and a little extension of that joint to, get things stretched out, get things loosened up, get those adhesions broken up. But it's communicating with the doctor, communicating with the massage therapist, and vice versa. Back to the patient, saying, okay, is this good? Are we getting in, deep enough on that, or are we actually too much? Sometimes people, I like it deep. And the therapist drops the elbow down and they come up and they go, man, that really hurt. Well, if it really hurt, not necessarily a great thing. Massages sometimes aren't comfortable, but they shouldn't be painful. Talk to us, say, hey, man, that's a little bit much. Can you back off a little bit? Sure. And same thing with the adjustments. Well, that last adjustment, man, you were a little rough on me. Okay, that's good to know. I can lighten up my tension or lighten up my pressure, and make it more comfortable for you. At where I used to work, one of my patients calls me the bone breaker, because you're the only one that can get in there and get my neck going. And so somebody hears that and they're like, I don't want to go see him. He's known as the bone breaker. It's like, but if you tell him, he'll lighten up, and he's not always the bone breaker. So,
wow. Well, you know what? Why don't we get past what people think, that you got to get in there and dig in and dig. Not necessarily. Even a light touch massage, I don't even know what that would be called. There are many benefits from that, right?
Absolutely. More like the Swedish is going to be more relaxing. You're just kind of, just pushing the energy around. You're obviously doing work with the muscles, but you're, just taking that deep breath in and deep breath out, and just kind of centering the body, so to speak, rather than a deep tissue where you're in there and you're trying to, make a change.
You are radically different in your practice, in my understanding and seeing others, aside from, you and your team and what you offer, membership model. Tell us about that. Very unique.
Well, yeah. The company I worked with before I opened up here was a membership practice, a small franchise. Loved it. I go in, we don't schedule. That's primarily walk-in only. We like to schedule our new patients if all possible, because they do take a little bit longer. The stress levels are low. We don't bill any insurance at all. And our memberships we have a relief care, which is up to 10 adjustments a month for $97. And the wellness care is up to 4 adjustments a month for $57. And that wellness, if you come in twice a month, basically your membership is paid for if you're paying as you go, which is 37.
Wow. Hold
Yeah.
on. I got to ask it. Did I
Well,
hear you right in that number that you just said that it is $97 a month and that, David, entitles you to how many
up to 10.
adjustments?
Up to 10. You can get the calculator out.
I am.
Comes out to about just under $10.
Well, I just went where I just went. Okay. They're doing it for $35. That's $350 if I do 10. Wow.
Yeah.
That is what a no-brainer.
No.
Gosh.
And
Fantastic.
the mentality for us doing this is I want people to come in and get the care that they want without worrying about if they're going to be able to put food on the table. We also have family memberships. So say you and your wife want to come in and you're on the wellness plan, you're paying $57. Her membership's $40.
Wow.
Oh, my kids to be adjusted too. I got 2 kids. Okay, great. The third one or the first kid is $30. The second kid is $20. So now the family can afford to come in to get care on a weekly basis or a bi-monthly basis. And they're able to put food on their table. They're able, to do things and not worry about, the finances. And when you take the finances out of the equation, people heal a lot better because they're not stressed about it.
Mm.
And when they come in, you see it. I hug a lot of my patients, high five, come on down. I come down like, Price is Right. I have fun in my office. I want my patients to have fun. But when you get on the table, it's time to get busy. We'll, give you a quality adjustment, best adjustment I can give, and send you on your way with a much better outlook for the day. And we'll see you next week.
Amazing. When are you going to franchise this?
Well, the plan, it's in the works. I got to get this guy up and running and moving along. My goal is to have 3 offices.
Wow.
As you can tell, not a spring chicken here. But I like to have at least 3 offices, if I do a 4th, I'm going off the deep end on myself, but I think 3 offices would be good the next 3 to 4 years. Hang on to them for a little while. Right
Love
off
it.
in the sun.
I got to tell you, I left today, and it was the first time in a while of getting adjusted. As I told you, David, I paying $35. I was like, well, that's a good deal. Like, this
Actually,
is
35 is a good deal.
yeah, but the membership model, I would probably, not that it's a lot of money, 35, but I would probably be more apt to go more often. Am I going to hit 10? I don't think I have time or even close to that. But you're encouraging people to stay healthy, feel better. Obviously, massage is different than the adjustments. That's not under the membership model, correct?
Not yet.
Okay.
We won't put that out yet.
Yeah.
No, it's in the works. I'm thinking about it. I just want to stick one with the membership as for the chiropractic, but the more I sit back and people are getting massages, and it's like, well, why don't we do something like that? It's massage envy or whatever. You never know who you're going to get unless you specifically ask for that person. So maybe here in the near future, we'll have a model for the massages, and then maybe a model for the massage and the chiropractic combined.
Right.
So your wellness adjustments, and then you get your couple of adjustments, or I'm sorry, massages that month with it.
Yeah.
Give you more of a discount so you can get both. Because I've had people ask, I say, what if I come in a couple times a month? What kind of deal can you do for me? Well, I didn't really have a deal then, but I might have a deal for you here
Yeah.
in the near future. So,
well, here's the deal. It's about feeling better, feeling healthy, and that's what you're all about, you and your team. And it's clear. I mean, this is your purpose in life, and making it easy for people as well. What's your website for the practice?
It's www.spine-spot.com.
Excellent. Learned a lot today. I got to tell you, David, fantastic. Fantastic what you're doing there. Wish we had you here in the New York area, but you're located North Richmond, Richland Hills, Texas, correct?
Yeah, North Richland Hills, yes.
Got
Kind of northeast county area. It's the Fort Worth side of the Dallas-Fort Worth area.
Got it. Appreciate you
So,
being here today. I really do. Like a lot, your energy is fantastic, and you even recognize energy in what we were talking about a little bit earlier about putting things out into the universe and getting it back. And you're putting positivity out there, so it's coming back your way. Thank you so much for being here today. Really appreciate it.
thanks for having me, Steve, and we'll see you next time.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.